If you've ever experienced deep pain in your buttock that shoot down the back of your leg, you've probably been told this one thing: piriformis syndrome. Here's the truth. Not every case of glute pain is piriformis syndrome. And not every piriformis syndrome is treated the same way. Today, I'm going to share 4 surprising truths that completely change how we evaluate and treat this condition. Let's start with the biggest mistake people make. They never check the spine. Remember, the sciatic nerve doesn't begin in the piriformis. It begins in your lower back. That nerve exits the lumbar spine before traveling through the pelvis and passing underneath, or sometimes even through, the piriformis muscle. So if a disc in your lower back is irritating that nerve, the pain can feel exactly like piriformis syndrome. That's why the very first thing I do in my office is clear the lumbar spine before I ever blame the pelvis. Simple movements like bending forward, leaning backward, or rotating your spine can provide valuable clues. If those movements reproduce your glute pain or leg symptoms, your back may actually be the primary source. Now let's move to surprise number 2. There are actually 2 completely different types of piriformis syndrome. For years, we assumed every painful piriformis muscle was tight. Newer research suggests that isn't always true. Some piriformis muscles are shortened and in spasm. Others are actually over-lengthened and weak. Think about that. One muscle needs to relax. The other needs to become stronger. If you treat them the same way, you're likely making one of them worse. This brings us to surprise number 3. Stretching isn't always the answer. If your piriformis is truly shortened, stretching and soft tissue work can be very helpful. But if the muscle is already overstretched and weak, aggressive stretching simply places even more tension on an already irritated muscle. Instead, those patients often need strengthening exercises that improve hip stability. That's why understanding the cause matters so much. Now for surprise number 4. The real problem often isn't the piriformis at all. It's poor movement mechanics. One of the biggest movement faults I see is the knee collapsing inward during squats, lunges, or stairs. Every time that knee caves in, the hip loses stability. The piriformis becomes overloaded trying to stabilize the joint. Over time, it becomes irritated. Instead of simply stretching the painful area, we need to retrain movement. So here's the takeaway. If you've been stretching your piriformis for weeks and nothing is changing, stop asking, what hurts? Start asking, why does it hurt? Because sometimes the problem starts in your back. Sometimes it's a muscle that's too tight. Sometimes it's a muscle that's too weak. And many times, it's simply the way you're moving. Once you identify the real cause, your treatment becomes much more effective.